Well, welcome to all of you, and thank you for being with us this evening. Well, let's start with you, Leah. We're all, of course, concerned about the fate of Roe v. Wade, and you've worked as an attorney on the legal front of reproductive rights for some time. Can you give us a brief overview of what's currently at stake as cases are expected to come before the Supreme Court, maybe starting with what we won and what we didn't win in the actual Roe v. Wade ruling, and how important that really is, given how much of it's been chipped away through state legislatures around the country. Leah, can you get us started?
It is such a pleasure to be with you tonight. So what we won, not to state the obvious, but what we won with Roe versus Wade is a constitutional right to abortion. And I just don't think we can overstate how important that is. Prior to that case, almost all states had banned abortion. It is estimated that 5,000 to 10,000 women a year were dying due to illegal abortions, and that's not going through all the other health ramifications. And up to today, there are at least 24 states that are overtly hostile to abortion. So without Roe versus Wade, it is likely that many of those states would go back to banning abortion. So it is not too much to say that gaining existing but previously unidentified right to abortion through Roe versus Wade is a huge, huge win and continues to be today. With that said, there are unfortunately a lot of weaknesses when it comes to Roe versus Wade. I think to understand those, we have to understand what it really gave us. You know, we talk about it glibly as this right to abortion. In actuality, what Roe versus Wade was saying was within the right to privacy, and that's really important, within the right to privacy, states cannot interfere with a person's right to abortion. So first of all, that's a negative right. It's not a positive right. And by that, I mean, we're not saying the government has to ensure that you have access to abortion. They don't need to make sure that you can afford to get one or that there's an abortion clinic anywhere near you. They just can't interfere with your right to gain an abortion. That kind of sucks at the end of the day. That's my legal terminology for it. And we saw that almost immediately after Roe versus Wade with the Hyde Amendment, which is federal law that says federal dollars cannot go towards an abortion. So that fits within Roe versus Wade. The government isn't required to give you that money to get an abortion. But on the ground, what that means is people who don't have a lot of money, low-income individuals, aren't going to then be able to access abortion because they won't have Medicaid to do it. So Roe versus Wade, while it created this right, not everyone can actually access it because it's a negative right. I would also say that this negative right is further limited because government can't interfere with the right to abortion unless they have a compelling interest. And so that means they still can interfere. They just have to show they have a compelling interest, which means that it opened the door for a lot of state restrictions that we have seen. Other case law did the same by turning abortion rights into an undue burden analysis, but it opened the door for those state restrictions that we soon saw. I'd also say that one of the weaknesses of Roe is it's grounded within the right to privacy rather than or in addition to equal protection. A right to privacy is important. Bodily autonomy is incredibly important. The right to abortion and reproductive justice is about so much more than that. It's about the ability to interact in society, to be economically viable, to be socially viable. And we don't get to all of that with the right to privacy, where we could potentially through a right to equal protection. So that is sort of a very brief, what I'd say, Roe versus Wade. We won, we lost. Ultimately, we did win a lot, though, and I think that's important. States have continuously chipped away at this. The Supreme Court has continuously chipped away at this. And as we look at this new Supreme Court, which frankly, I think as we all realize is not friendly towards abortion, I think we have to deal with the very real possibility that number one, Roe may be overturned. Roe could absolutely be overturned. And if so, we could end up in a situation pre-1973, which is basically a legal patchwork where you have the South and some of the Midwest without any access. And again, social economic factors and geography will be completely dependent, will determine whether you have access to abortion. There is also the very real possibility, justices, lawyers hate overturning precedent. We get very nervous about the idea of overturning laws that exist. So the court may decide instead to just chip away at it, or being this court, sort of take a sledgehammer to Roe versus Wade. And in that instance, all they really have to do is uphold state restrictions. And hostile states know this. They have brought abortion ban after state restriction after state restriction in the hopes that these will be taken up to the Supreme Court and the Supreme Court can then uphold them. And if they do that, we don't have to overturn Roe versus Wade to have it not mean anything. You can say that abortion providers need to get privileges at a nearby hospital, as the cases came up in 2020 and 2016. And ultimately, that can mean there are no more abortion clinics available to you, right? You don't need to overturn Roe versus Wade not to have access. One thing I will add, though, while we're talking about the Supreme Court, I think it's really important to recognize there's also Congress. And while a couple months ago, one of the big fears was, Roe versus Wade can get overturned, and then Congress might have a federal ban on abortion, and what will we do? And I think now what we also have to focus on is Congress can help protect abortion access. There are multiple bills in the works to ensure that there is coverage for abortion and to limit states' ability to enforce abortion bans or restrictions on abortion. And with this Supreme Court, I just think this is extraordinarily important.
Willie Parker, you're practicing in many states and you've navigated these troubled waters for some time. What would you add to what Leah's saying about the different situations in different states, and you also have spoken about the limits of Roe v. Wade. What would you add to that? What's your assessment of where we're at?
Well, first, let me thank you for the invitation to participate in this panel. And let me just kind of update my practice profile at this point. Although it sounds like, I think it was Woody Guthrie made that song say, I've been everywhere, man. And it sounds like it when you look at my abortion trajectory. But right now I'm practicing in Arkansas at the only clinic in Arkansas that provides surgical procedures or procedural abortion. Actually, I come to Seattle as well as as well as working in Las Vegas. So I'm still in the mode of going to where access is needed. But I would add in terms of, somebody once said that in theory, there's no difference between theory and practice, but in practice there is. And so in echoing what we just heard in that very nice summary of what Roe provided and what Roe didn't, I think one of the things that in my cynical take and my active effort to look at, there's on the surface it looks like Roe was about ensuring access for women and people who can get pregnant to have abortion. But my cynical take on it is it was as much about ensuring that doctors had the right to practice their craft, which then means that it made us too central to the role of access by creating this expectation that you have to have a medical degree to be a provider. And all of us who provide know better than that. And I know Sarah's traveled the world training folk where there are no doctors available and yet training people to safely provide abortion care for people who need that care. So what I've seen is what I call regulatory mischief, where people play very strictly with legalism to create the injustice that occurs when there's, quote, too much justice. When you really need strict laws when there's no justice, right? if we were to really be interested in protecting the health of people who become pregnant, and if we were really willing to understand the evidence-based reality of there are people who want to be pregnant and who can't, and there are people who don't want to be pregnant and who are, and the presence of justice and simply the absence of tension around denying people access to the care that folk who, despite the law, have financial means to access. I'm seeing that play out. It plays out along the lines of race, but it really becomes a class and an economic issue. And so as I've worked around in different states, part of my traveling is I've felt the vulnerability of people in various regions, primarily the South, of lacking access simply because of their zip code. But I would also, in the way that Malcolm X said that when he was asked if things were better racially up north than they were down south, he said, no, things were as bad up south as they are down south. And the journalist, puzzled, asked, what did he mean by that? Minister Malcolm X said, well, when it comes to race relations in America, I define South as south of the Canadian border. And so when you look at the restriction, you have a hard time telling a woman in Ohio with the restrictions there that she has an easier time getting an abortion than a woman in Mississippi. So in some ways, we are already post-Roe in terms of the spotty patchwork, and even in places where there are clinics, the restrictions are so heavy that because it looks like the thing that we're fearing greatly, in some ways, we're already there. So I really think that our understanding of the role that advocacy is going to play beyond, advocacy with our legislators and informing them and insisting on evidence-based practice, I think we also have to think creatively around how to work around the laws, because those of us who provide this care, I don't think any of us are more committed to it simply because it's legal. We understand the importance of it irrespective of the legal status. And so we have to figure out, what are we going to do when the laws don't permit us, when the laws try and stop us, I should say. The laws aren't what permit us to do this care. It's the compassionate actions of people who are acting out of conscience to do it. But what are we going to do when people prevail legally and prompt us to act and challenge us to act unethically towards our patients, when we know that this care is ethical and moral, and it's not, we can't simply defer to people framing it based on their non-scientific understandings of reproduction.
You've brought in this concept of conscientious provision to counter the discourse of conscientious objectors to providing care, that you come from both a feminist and a spiritual point of view in the commitment to providing care, which I think is such an important kind of moral argument, as well as a medical clinical one. One of the aims of the film was to show how even in the progressive areas of the country, there is a lot of religious control over access. And I know, Leah, you have things to say about that, but perhaps some of the providers here in the Pacific Northwest, Sarah, Deb, and Mark, can you say something about this issue of particularly the Catholic bishops and their so-called ethical and religious directives, and what's happening in the Northwest, where there also are challenges to access to care? Sarah, do you want to start? And then Mark and Deb, you may want to add some things as well.
Sure. First, thank you so much for inviting me to be a part of this panel on a day special to all of us who are here. And thanks also for asking me to speak specifically to this. It has a lot of importance in Washington State. I think a lot of people who live outside of Washington and maybe inside of Washington are surprised to learn that so much of our state healthcare is controlled by religious institutions. And there was just a recent merger that puts us over the 50% mark now. So over 50% of our hospital beds are now controlled by religious institutions that restrict access to full spectrum reproductive health care, as well as end of life care and LGBTQ care in many instances as well. So the ethical and religious directives that are set by the bishops indicate that you can't treat an ectopic pregnancy, you can't provide certain forms of contraception, including tubal ligation, you can't do abortions at all, you can't provide miscarriage care if there's still a heartbeat, and many other elements. And those directives, though, are not uniformly applied at different healthcare systems. So some healthcare systems that might be affiliated with a Catholic institution might not actually implement any of those things, whereas others might implement all of them, which creates a whole lot of confusion among providers. And the end result is that providers are fearful of doing anything along those lines because they don't want to lose their jobs. In Washington state, half of the jobs that doctors or nurses or MAs or anesthetists or anybody, nurse practitioners has access to are now in these Catholic institutions. And so this is not a small issue. And of course, patients usually have no idea what they can and can't access at these various hospitals. If they have an emergency, like an ectopic pregnancy, they go to the nearest hospital. They don't stop and look on the website to see what reproductive health services they offer or don't offer. So it really creates a terrible situation for patients and for providers as well. I will say one of the ways in Washington state that we have tried to combat this is through legislation. And there is active legislation this legislative session, actually, that is going to try to address that, both with Protecting Patients Act that will make it illegal for the healthcare entities to restrict evidence-based emergency care that clinicians provide, and then also a merger bill that will require some deeper scrutiny anytime there's going to be a merger to make sure that vulnerable populations and various communities are not negatively impacted by then not having access to all of these essential services. So, you know, even in liberal Seattle, in Washington state, which, you know, maybe second only to California, has extremely friendly laws for allowing patients to have relatively good access to abortion care. I think people are surprised to hear that these restrictions still apply here.
Deb, can you add to that point and your emphasis on the, bringing a more complex view of abortion care into the public discourse and onto the stage, because in the pro-choice movement, often there's been avoidance of terminations in the second term, the issues that come up at various gestational ages of the pregnancy. Can you speak to that? Some of what you see as the complexity of abortion that's important for us to be able to take up.
This has come up a few times recently. And as Sarah said, we just had another merger. But two things that came to mind while Sarah was speaking. One is because so many people work in these Catholic hospitals and they are not allowed to do abortions, they do not have the skills to end a pregnancy in the second trimester, even when there is no fetal heartbeat. So if somebody has a fetal demise, meaning their fetus dies in utero, they don't have the skills to take care of their patients what the patient thinks is the hospital they go to. And so they have had sometimes a wanted pregnancy following with their OBGYN, and when they need surgery, and to them very sad surgery, to end unwanted pregnancy. They have to find a new provider at a time that's very difficult for them. And that's because these providers have worked for a Catholic hospital, they do not have the skills they need. In addition, we run into this in non-Catholic hospitals as well. I had a meeting recently with the hospital nearest to us, where nearest to Cedar River Clinic, where we had a patient who went there for something called a placental abruption, meaning her placenta was pulling away from the uterus, causing a very big amount of bleeding in her uterus and getting hypotensive, losing her blood pressure, etc. And it became emergent, but there was only one doctor in that hospital, which is not Catholic, who does the procedure that she needed and was unavailable that day. So with her blood pressure tanking, with her bleeding internally, she had to get transported up to University of Washington to have her procedure. So even in a place where there are people who are pro-choice and believe in people having access to this, because of all sorts of institutional anti-choice issues, people are not able to get the procedure they need when they need it. And so I think there just is so much judgment involved in people who have abortions at all, particularly those who have them in the second trimester. Sarah and I were just talking about a patient that we referred from Cedar River up to University of Washington, and how many people at University of Washington, where she is an outspoken abortion provider, so nothing is a secret there, were sort of shocked that this person was allowed to have an abortion this late in pregnancy, and is this legal? And the number of different people who asked that question was sort of shocking to both of us. So I think, one of the reasons I chose to be in this film is because I think we don't talk about abortion enough in the nuts and bolts of it. And I think people need to know what's legal, why people make these choices, and that most importantly, it is safe and legal. And I think, at least in our state, it's legal and accessible for the most part, even though I've just told you all the ways it's not accessible. But I do think that we need to have more and more discussions. I mean, I think, as this year has shown us, we need to have more discussions about race. We need to have more discussions about abortion. We need to have more discussions about hard topics on which people disagree and on which there's a lot of nuance to bring it out into the open.
I know, Mark, you wanted to be or agreed to be part of this film project because you wanted to bring abortion care into the context of a spectrum of healthcare needs and move it from the margins into the everyday world of healthcare. Loretta Ross, you have also written and taught and advocated for abortion in the context of reproductive justice. And we see you in the film as part of the work that Black feminists brought to the abortion rights movement in the 1990s. Sister Song has been part of that important lens on abortion rights organizing. You're working on a book now with colleagues entitled RJing Abortion. Can you talk about what that term means and what it calls for as this way of thinking about the context of abortion?
Well, thank you for again having me on your show tonight. When we created reproductive justice in 1994, we were actually at a pro-choice conference in Illinois. And the we I'm talking about is 12 Black women. And at the time, the Clinton administration was trying to pass a version of healthcare reform. And they had the impression and the strategy that if they omitted reproductive healthcare from healthcare reform, they would increase the likelihood that they could get some Republican support for their strategy. And when we 12 Black women heard that proposal, we were appalled because reproductive health care is the main driver of women to the doctor. And then we couldn't believe that they were so unstrategic to come to a feminist conference and ask us to support what was a male-centric healthcare plan. Because if you get reproductive health care, you basically decrease the likelihood of encouraging women to support it. So we strategized that night and we coined the phrase reproductive justice. But reproductive justice was a splice of reproductive rights and social justice. But before we even got there, we argued that there's something wrong with a framework that isolates abortion from all the other issues that take place in people's lives. First of all, it needs to be embedded in routine healthcare. But secondly, women recognize that if they have all these other social justice problems in their lives, lack of housing, freedom from violence, lack of affordable health care, or job insecurity or things, then you really increase the likelihood that a person is going to seek an abortion. So even a planned pregnancy may turn into an abortion. But if the person has good answers to these human rights issues in their lives, even an unplanned pregnancy may turn into a wanted child. And so when we looked at abortion, we first didn't want it isolated from all those other human rights and social justice issues. And so that's why we created the concept of reproductive justice. And a lot of people mistakenly think that we created it as a way to avoid talking about abortion, but nothing could be further from the truth. It is in fact embedding abortion and calling for a human right to an abortion. And so a lot of people get it wrong simply because we enclose it within the human rights framework and talk equally hard or equally strongly about the right to have the children that we want to have, which is the second tenet of reproductive justice. And the third tenet is the right to raise our children in safe and healthy environments. And then a fourth one has been added to the right to gender identity, body autonomy, and sexual pleasure. So we see reproductive justice as a framework capacious to include the necessity and the urgency of protecting abortion rights. But even if abortion was made totally free, totally accessible to every woman in America, that person still may be poor. That person still may be dealing with poor schools, gun violence, environmental issues. And so isolating abortion from not only healthcare, but from the human rights framework does not work well. And so I want to salute all the doctors who are here because y'all are human rights defenders. Not only are you defending the rights of people to control their reproductive decisions, but you're always placing your lives on the line to do so. And those of us who are advocates and organizers have total appreciation for the work that you do. And I'll just close that even doing the mild work that I do, like writing about white supremacy and fascism, I've been in the middle of a troll storm for the last 48 hours, even having my writings featured on Fox News, which is always a sign that they're teeing you up for something. So all of us who fight for human rights, suffer some risk, but nothing like what y'all go through, because y'all go to work sometimes in things that can be described as war zones. And so I'm very proud to be working with y'all and know y'all.
Loretta, you're very modest given the scope of your work. Willie, you also have talked about some of these same dynamics, the importance of a reproductive justice framework, addressing the element of racism that's exploited by anti-abortion forces. What do you think is continues to drive the enormous investment in this issue on the part of the right wing and conservatives?
I think the racialization of reproduction and of reproduction and in particular of abortion, the striking irony is this preoccupation with fetuses and the feigned concern about Black fetuses or Black babies, with total being totally oblivious to the rise in maternal mortality and the disproportionate rise in maternal mortality for Black women, tells me that the interest is a feigned concern and is merely it's a tactic. It's a recognition of the failure of there being any critical dialogue on race relations in this country, and the failure to reckon with a historic narrative that facilitates white supremacy that's collapsing before us as we speak. But the pedestalizing of reproduction as an essential human responsibility that falls primarily to women or those people who can carry pregnancies kind of posits, it lends a legitimacy and a moral authority to this preoccupation, to this tactic that is not there. As I said, it's as Loretta pointed out, to isolate reproduction and to pull it out of the context of the lives of the people who have to manage and decide what to do with a pregnancy, really, again, provides this cloak, of in a society that doesn't talk honestly about race and that does not want to acknowledge white supremacy. The feigned concern about Black reproduction is really the cloak to continue facilitating patriarchy by controlling the reproduction of white women, because the only people who can have white babies are white women with white men. And so there's a chapter in my book, as you may know, called it's about this whole feigned concern of, or the racialization of abortion, with on the surface an apparent respect for life and a championing vulnerable populations when you start to describe the fetuses of Black women as Black babies. But it's really an attempt to undermine reproductive rights by taking on people who can't fight back. The disenfranchisement, if you look intersectionally and look at women who are a discriminated against group, Blacks who are discriminated against group, and put it together, Black women, and then you start talking about this whole paternalistic caretaking role that is part and parcel of patriarchal thinking. I think it really becomes critical to think about race in honest and nuanced ways, and to think about reproduction when it's racialized. And when you put those two things together, you can pierce through the tactic that continues to facilitate this abortion terrorism and the tyranny of reproduction, but under the veil of a feigned concern about race.
There's so many levels to this intersectional analysis that both you and Loretta bring to this issue, and we try to bring into the film as well. Mark, you also talk about the women who are most affected by all of these laws restricting and chipping away at abortion, the women who have to travel distances and go through many hoops to get care, who are sometimes pushed into another further along in a pregnancy, and are often the most disparaged and demonized for seeking abortion, Mark, can you speak to that in terms of how you understand kind of the politics of access to abortion and who suffers most from this chip away at access?
I just want to thank Loretta and Willie for speaking on the intersectionality of racial justice and social justice and reproductive justice and how those all are interrelated, and your voices and activism in that area is just so critically important, even more now than in the past. My work, as Jen mentioned, has been involved most recently on the political and legal front. And I wanted to circle back to what Leah was saying initially and the importance of the legal decisions that are made. You know, we're in the sort of abortion oasis here on the West Coast, and people like Willie and others who are in these very underserved areas are fighting a fight that we can't even imagine. I run into cases all the time where there's not an abortion provider for one particular case, but right next door, I've got about 7 people that have come through fellowship training who can step in and take care of things. That is just simply not true in places like Arkansas and Mississippi and Alabama and so many other parts of the country. The recent work that I've been involved with has been fighting this legal fight. And I want to thank folks like Leah and the large number of incredibly smart and energetic young lawyers who are, in state after state trying to push back on these crazy laws that restrict abortion in so many ways. And to the point of access and its impact on gestational age of an abortion when it is ultimately obtained is a very real concern, because it's clearly known that the rate of complications and the risk of mortality goes up consistently with increasing gestational age. And so these restrictive laws that make women get their abortions delayed because of biased counseling or enforced waits between consenting and procedures, or having to travel long distance because of lack of access to facilities that provide abortion. I mean, there's so many factors that go into delaying the ultimate obtaining of an abortion. It is a very real medical concern. So I would hope that all of us, in addition to being motivated to help on the specific provision of abortion services in the healthcare world, we also need to support the legal efforts that are going on in whatever ways we can, by testifying or by financially supporting the legal efforts that are going on to push back on these laws. The anti-choice legal efforts have been incredibly effective across the country. I mean, again, we have very few restrictions. We have no restrictions on abortion at all in Oregon. And that is just so different than most of the rest of the country. And so there's a lot of work to be done. And it's a great day to be celebrating the 48th anniversary, but we have a long ways to go to really achieve real access to abortion care in this country. So again, thank you for having me participate.
So Leah, do you want to add anything and carry us further down that road, and whether we should continue to look so much to the Supreme Court, which is less and less our friend, and what are some of the other legal fronts, especially today? Joe Biden issued a statement that was music to our ears about the intention of the Biden-Harris administration to move through Congress. How would you assess those legal fronts versus the more depressing prospects for cases before the Supreme Court this year?
I think that's a great question. So as I said, I think we really do have to focus on Congress to a degree right now, right? Supreme Court is not our friend. We need, and in individual states, as you've heard tonight, as we know, there are just so many abortion restrictions that mean people don't actually have access to care. We need the Congress to take steps to ensure that states can't put these bans in place for gestational age, for many other reasons, and that restrictions are very limited. At the same time, we need to ensure that people have coverage to access abortion. And right now, the federal limitations just don't make that feasible for low-income individuals outside of states like I live in Washington State, where we have a state-funded Medicaid program that provides coverage for abortion. So to have at least, the bare minimum of equity, we need these federal steps to occur. I would also say, when we're talking about, what other legal steps we can take, the law is so slow. The law is so far behind generally where society is, that what we need to do is we need to, I would say, move society, and then the law slowly, but very, very slowly, but surely comes with us. And I always think about gay marriage and how really there was this incredibly strategic effort, and it took so many years. But what you saw was basically society got there, state after state after state after state got there. And then finally, at the very end, when everyone else was almost there, is that the Supreme Court was like, okay, cool, yeah. And it sometimes takes that where society really has to get somewhere before the Supreme Court's going to get on board. And so while I think the Supreme Court is not our friend, I think if we can continue to move society in a direction where they understand abortion, and they understand abortion in the context of reproductive health, in the context of reproductive justice, then we can continue to bring those cases, and ultimately, once we get society in the right place, have more wins at the Supreme Court level.
Loretta, how would you respond to that? Because I think this was a motivation behind the film itself, was helping people to talk about abortion, to have conversations about it, taking up its emotional complexity and aspects of abortion that make people uncomfortable, partly because still very much behind closed doors, even if it's not carried out in the back alleys so much, it's still the back halls of the culture, so to speak. So Loretta, how do you talk with people in a way that addresses some of the anxieties and putting it in the context of reproductive justice? People who are maybe less supportive after very early terminations. I think the majority of the public support Roe v. Wade as it relates to early terminations. But then you get into areas where people, where some of that support drops. How do you talk with people who are ambivalent about abortion?
Well, frankly, I aim most of my conversation towards people who are even at risk of needing one. So I don't spend a lot of time talking to people who will never get pregnant or people whose pregnancies are in their distant rearview mirror. I spend a lot of time talking to the people whose lives are still being determined and affected by these laws. And I have a lot of practice at doing that, because a lot of people don't know this about my former organization, Sister Song, but we were founded in 1997 by people who consider themselves both pro-choice and pro-life. But we never debated over abortion, because the people who defined themselves as pro-life took the stance that, well, maybe I would never have one, but I'd never stop you from doing so. And that's a pro-life stance I can relate to. I mean, if you stop with your body, but you won't keep other people from managing their own bodies, That to me is in a reasonable position that I don't necessarily agree with, but then I don't like butter pecan ice cream and people do. So, I mean, people have a lot of different opinions that I can listen to them without agreeing to them. And that's how we're supposed to work in a pluralistic society. I also wanted to pick up on an earlier point, I think it was that you made, Leah, that we learned in the Black movement that the law will only be as good as we make it to be. That we've had civil rights laws on the books since the end of the Civil War, that it took a civil rights movement to get enforced. And so the law never leads, the law always lags behind because the laws and their enforcement is largely for the benefit of the people who benefit from injustice, not the people who want to end injustice. And so leading with the law is always a problematic strategy. And as a reproductive justice activist, I just want to bring in some other things into this conversation. Because reproductive justice at its heart offers a strong analysis against white supremacy, we even embed the fight against abortion in the fight to maintain Jim Crow segregation and the fight to oppose LGBTQ rights, to oppose the rights of immigrants, to oppose taking care of the environment. I think that there's a manipulation of people's feelings around abortion to serve the financial and political interests of a small set of people. And so when we isolate the struggle from abortion from all the other human rights issues that intersect with it, we're really under analyzing the threat, because the threat is that the anti-abortion movement was built together because in order to run for president, Ronald Reagan decided to knit together the segregationists, the anti-feminists, the anti-gay people, the anti-immigrant people, and then use the evangelical religious right people as a vehicle to get in power. And that's been a strategy of every Republican candidate for president ever since. And so if we only focus on abortion, we're going to miss the larger narrative of what's really going on. And that's why they're so transactional when it comes to abortion, that they're very opportunistic, not morally determined, but there are a lot of people who can be lied to and manipulated. And that's what's going on with the Trump insurrection and all of that. And I'll say one last thing. As a reproductive justice activist, I've never been totally preoccupied with this legality, because I always knew that we in communities, our midwives, our doulas, as we've always had to do since the enslavement, we're on the front line for saving people's lives. We don't have licenses to be pulled or student loan debts to pay off and stuff like that. That we always know that we're going to be frontline defenders too, because we can't let the courts determine whether people live. We simply can't do that. That's a form of necropolitics, to decide that the law is going to determine who, that whether or not a woman, or as Willie says, a person who can get pregnant can live or die. That's just not what we do. And what we need to also bring into this conversation is something that we're very high on, and that's self-managed abortions. So that we there will always be a need for surgical abortions, and SMA only works early in the pregnancy. And a lot of people have a whole lot of reasons where they can't get a pregnancy test or acknowledge that they're pregnant or anything until way too far into the pregnancy for an SMA to really work. And so that's the topic of our book, RJing Abortion, contextualizing abortion within this struggle for overturning democracy. It is not to be isolated from that. And I'm co-writing that. Marlene Gerber-Fried is the lead author on that. And I'm writing it with Namrata Jacobs, because we want to place the struggle for abortion in a larger conversation about the overturning of democracy. It's not just about women's rights. It is about the threat to our democracy that's been mounting since the Brown v. Board of Education decision in 1954, as Nancy McLean wrote in her book, Democracy in Chains.
I just wanted to, as I was listening to Loretta, one of the things, harkening back to your point about how we move the public so that the law can catch up. I think one of the things that I've tried to do is to try to create opportunities for people to explore nuance and to reframe the notion that the dichotomy is pro-life, pro-choice, and try to add some nuance and to help people to understand that in the way that I consider myself pro-life, I am pro-choice or pro-reproductive rights and pro-life. I'm simply not anti-abortion. And I try and give the example of, as an abortion provider, I'm interested in making sure that everybody who needs, every woman and every person who needs an abortion can get one. And the same, I'm pro-abortion in the way a cardiothoracic surgeon is pro-heart transplant. They don't want anybody to have heart disease that requires them to need a heart transplant, but they want to make sure that someone who has a diagnosis where the treatment is heart transplant can get one. That's how I see abortion. So I really, when I engage people like Loretta, I don't talk to people, I don't spend a lot of time in an academic debate with people about the merits or demerits of abortion. But when I do engage somebody, if they are honestly engaging and willing to honestly disagree, I try and help them to create, at least to concede that to be anti-abortion is not the same as being pro-life, and to be pro-reproductive life has the capacity and is very much an expression and affirmation of being pro-life.
So thank you all. And now I want to open it up to some of the questions that have been coming in from our attendees. Many of them have to do with advocacy, what kind of activism should we be organizing? There's one for Sarah. For institutions who are under the control of the church and have restrictions due to it, is there an effective way to fight back?
You can find another job. That's a little bit of a glib answer, and I don't mean to be glib. It's difficult because in many places, I would say, as far as I'm aware, most places, most Catholic run institutions anyway, require all of the employees to, in their contract, sign something that says that you will abide by the ethical and religious directives. And if you've signed something, it's in your contract, it is directly opposed to many things that as a physician, you have vowed to uphold, like practicing evidence-based medicine, like putting patients first do no harm, don't abandon your patients. All of these primary directives as a physician are in opposition to somebody telling you that you can't take care of somebody if she has an ectopic pregnancy, or if she, is in the middle of a miscarriage, but the embryo still has a heartbeat. So, you can be very questioning before you actually sign a contract. You can see if you can not sign that contract with language like that in it. If you are already existing,
are you
physicians, right?
When you say,
yeah, that was my understanding about the question. If you're already working for a Catholic healthcare institution. I think Leah could potentially answer legal recourses. You can always sue for wrongful termination if you do something that is the right thing for a patient and then are fired for it. But that's, a little bit like, the horse is already out of the barn at that point. And so I don't know if that's very satisfying. I also think, if you're a patient and you get care at a Catholic institution or a hospital that you don't think is Catholic, but it might be affiliated with one, and those are really tricky. You have to do your homework sometimes to figure that out. Then you can get care elsewhere if that is possible. The problem is, at least in Washington State, sometimes that would mean driving hours, literally hours, to get to any healthcare facility that is not affiliated with a Catholic institution. So the logistics of that are not always feasible, which is why I think it is such a big and important problem. So I don't know. I don't think I answered that very effectively, but maybe Leah has some other ideas about legal recourse.
Well, there are several other questions, and that I know there's organizing around that issue that has prevented mergers in some places, like UC San Francisco, where community and staff get together and resist it. But there are several questions involve how to organize, or given the institutional racism built into our healthcare system, how do we organize for abortion care and reproductive justice within the healthcare system itself? What should we be organizing around or advocating for our healthcare system as we now think about Medicare for all and other ways of widening and transforming the healthcare system? Mark, do you want to take that one on first?
Yeah, I'll touch on that a little bit. And the timing is perfect. We spent 3 hours in our department this morning on a diversity, equity, and belonging seminar. We had presentations from researchers, from residents, from nurses, from social workers, faculty, and really sort of put a pin in the importance of doing a better job with increasing diversity in our department. And for me, that's the bottom line. I mean, I really feel it's critical that we increase diversity in among the providers that are providing these important aspects of healthcare. It's a big challenge, and I'm very proud of the work that we've done in our residency program. We've really been aggressive about recruiting people of color and from different backgrounds, and our group is so much more diverse than it ever has been. But it takes a long, long time for a real impact to be made. So I think that's one area that we really have to work on. But it extends beyond just a residency program. We really have to back that all the way up into elementary school and how we're teaching our children and giving opportunities for high school students to get engaged in various aspects of healthcare, and on and on and on. So there's plenty of work to be done. But I was very pleased with that very small step we took this morning in our department, and look forward for more of that. I think this is an effort that's going on across the country, not in all institutions, definitely, but it's happening more and more, and I'm happy about that.
So it's not just access to care, but how we think about care, and that was a big part of the feminist women's healthcare movement, was in rethinking the hierarchical and challenging many of the hierarchical aspects of healthcare. Willie, you also have talked about how to socialize medicine, which means different things to different people. There's a movement for Medicare for all that's generated quite a bit of support. Can you speak to what your vision of a humane healthcare system would look like, and what we should be advocating for or organizing around on that front?
Well, I was thinking about in the modesty of people like Mark and Sarah, in addition to being providers, they are deeply and actively and intimately integrated into the leadership of our trade organization, ACOG and ABOG, And they, as they have sought to understand and to come to make sure that they have the awareness and the cultural competency to go into those spaces where there aren't the people who are disproportionately affected by the adverse health outcomes, or the health determinants aren't articulated by somebody who's had that lived experience. I think introducing the awareness of health disparities and the role of workforce diversity, and talking about and making clear the difference between health, between equality and equity. I think getting into and changing the mindset and the culture and the definition of what constitutes quality care is huge. But I think also that's if you work within the system as it's currently structured. One of the things that I've become clear about in order to democratize access to abortion care and reproductive health has been to decentralize the role of doctors in that care. As I alluded to earlier, one of my classmates when I was a public health student at Harvard, she had been one of the co-authors of that very popular series around the world of books that When There's No Doctor. There was a book called When There's No Doctor, and it was about health solutions for women when there's no doctor. And so when we look at the role of self-managed abortion care in spaces where people don't have access, and increasingly in this country, one aspect of self-managed care is people who think that that reproduction is overly medicalized, and they elect to do a self-management process even when they have access to care. The challenge becomes, should they run into complications, how do we make sure that people are not women aren't locked outside of the system when they exercise options, or they have access democratized by the fact that they can go around the system to initiate a pregnancy termination process. So I think what was problematic about Roe, as one of the things that Leah alluded to, was I think the way the Roe was worded, where doctors are essential. I think how do we if we decentralize doctors, you can make that same film that you made that we participate in, Jan, said, Our Bodies, Our Providers. Now, if it was Our Bodies, Our Providers, that would be a different film. But part of what I see this film doing, Our Bodies, Our Doctors, and my willingness to participate in it when you asked, was to model and to kind of positively peer challenge doctors to use the communal and the societal authority and clout that they have to weigh in on the morality of assuring abortion access. So I would say my radical thing is challenging my colleagues to dethrone themselves in terms of being central to women having access to abortion care, by making sure that women have access to every level of expertise. We won't become obsolete, but I don't feel threatened by PAs or nurse practitioners, or in some extreme cases, trained lay health advisors acquiring the competency to provide abortion care. Because at the end of the day, we all know that what's most important in quality and safe abortion care is the competency of the person providing, not the terminal degree that they chose.
So all of you come out of through one path or another, the feminist clinic tradition, and bring feminist principles of care to your work, and as physicians have this larger identity as a provider, which we try to emphasize in the film, that people work at the desk, people who are many people involved in the care are providers, even though doctors have been the biggest targets legally and physically of the anti-choice pro-choice movement. The one question came up, Sarah, you, I know, have talked about this, the likelihood of overthrowing the Hyde Amendment, which has been authorized by Congress year after year, including by Democrats. And so that's wonderful to see movement on that front. Could you speak to that? And I don't know if Leah, you would want to comment on that as well, the likelihood of overturning Hyde. Maybe just say what the Hyde Amendment is first. Sarah, do you want to speak to that?
Sure. So Leah talked about the Hyde Amendment at the very beginning, and just to remind anybody who isn't aware, it is an amendment that passed very soon after Roe v. Wade that mandates that no federal dollars can be spent on abortion care, which also makes all of the brouhaha by the federal government about abortion absolutely ridiculous, because there is no federal money that is spent on abortion care already. So whenever they talk about they're going to stop funding abortion, answer is, great, you did that 50 years ago or almost. So as to whether or not that's going to pass, I do, I have a lot of hope. I'm also kind of pragmatic. And so I'm warring with those two sides in answering this question. I think as my co-panelists have all stated very clearly that, laws that are against laws that restrict access to abortion, that restrict access to contraception. So I don't want to talk about being pro or anti or any of those things, but anything that is restricting access to abortion care or contraceptive care, it is put in place for, to promote white male supremacy. So let's not beat around that bush anymore. So I think if we can continue a movement acknowledging white male supremacy in our country, and then potentially addressing it, I think acknowledgement has to come first, then addressing it, as Loretta Ross has said so eloquently, abortion is going to be a major part of that, or it should be. It should, it's wrapped up in it. And so I do think that with some of the activism we see in Congress, it's possible. But then my pragmatic side takes over. And so I'm not sure. Maybe Leah can speak a little bit more to what's probable. Sorry to leave that to you.
Go for it, Leah.
I don't think we can predict, everything that Sarah said. Yes, yes, yes. I think I am encouraged by the fact that the Each Woman Act was dropped in 2019, which is essentially reversing the Hyde Amendment. And that is getting traction. It is very, very interesting to me, going back to our conversation, how society changes before laws change, that the current president felt a need to reverse his position on Hyde when trying to become the president, because that's a statement of he felt he needed to do that to gain support, that society or a section of society wanted him to do that. And to me, that makes me somewhat optimistic in that we're gaining traction, and that going up to these higher level of politics, they are hearing that this is something that needs to happen. I am generally an optimistic person though, so who knows?
So there's some question about the role of films, like Our Bodies, Our Doctors, in creating more conversations about abortion care and reproductive justice. You all agree to be part of this. Maybe could each of you say a bit about why you chose to be part of the film itself, and what you would hope for this kind of project. And as we go forward and do other, kind of claim visual culture, which was an aim of this film that has been so dominated by the horrific imagery and distortions of anti-abortion forces. What is our role in doing this kind of cultural work? And what would you say to us as a filmmaking team about what you would like us to do in going forward? Loretta, do you want to speak to that first?
Well, I don't believe that telling our stories is ever wasted. The stories on all ends, the providers, the patients, the advocates, it's never wasted. But we also shouldn't expect it to do things that it won't do, because we live in a society against some opponents for whom they know the truth of what they're doing and they don't care. So if you work on the assumption that somehow by telling our stories to these people who profit from the abuse of human rights, you're going to make them care, that's not going to happen. I think that we have to build the reproductive health rights and justice wing of the human rights movement, working with the environmental justice wing of the human rights movement, and the LGBT wing of the human rights movement, and immigrant rights, and on and on. Sometimes we're just going to have to overwhelm them with our power and not our words, because I don't think that it's not a lack of being heard. We've had 50 years of telling our story. Hell, we've had hundreds of years of telling our stories. The thing that makes me most sad, though, about the fight for abortion is that when I was 16 years old and a first-year college student, I needed an abortion in 1970. And I was lucky enough to need it in Washington, D.C., that legalized it 3 years before Roe v. Wade. And I think that young people have a more difficult time getting an abortion now than I got in 1970. And that's just not right. That simply is not right, that we're going backwards in terms of human rights instead of going forward. So I just believe we have to overwhelm them with our power, make them, the pimples on the ass of time that they actually are. That this is what we have to do. I wrote an article, I've given up after 50 years of respecting people with great brains with all these Harvard degrees to figure out that they're doing wrong. I'm giving up on persuading them. Now I just want to overpower them and make sure that we look forward and stop keep fighting this unending civil war, this unending war on abortion, this unending war on gay rights. I am so tired of being trapped in the values of the 19th century by people who want to refight the Civil War and see if they have a better chance of winning it this time. I just want to overwhelm them and make them politically impotent, socially irrelevant, and they're demographically doomed anyway, because their whole plans depend on persuading a lot of white women to become, like 19 kids and pregnant, and that's not going to happen.
So Deb, do you want to say a little about what sustains you in terms of that, both the depressing side and the hopeful side of doing this work on a cultural level? As many of us as a film team, we consider ourselves activist filmmakers, and doing a kind of cultural work. There's no magic in storytelling or making a movie, but could you say a bit about what sustains you in this work?
So I have to say, Loretta, it's hard to go after you. I agree with everything you said. I think what sustains me, I feel a lot like Loretta does. I feel overwhelmed by the whole, my headset's going out, hold on. Can you still hear me?
Yes.
So I feel like going to the clinic one person at a time really sustains me, because I can make a difference to that person on that day. I feel like talking to people, as Loretta said, who are just never, no matter how we tell our story, are never going to agree with us, is a waste of time and energy. I had an uncle who was one of the most horrible people in the world, and there was very bright, and there was no convincing him of anything he didn't agree with. So I feel like we need to continue to talk about the mushy middle and overpower them, and then use them to overpower the right wing. And I think really, if I didn't do my job at the clinic, I would get overwhelmed by the enormity of the problem. But seeing one person at a time helps me daily. That said, I've had people lying on a table getting their abortion and telling me they're voting for somebody who's the anti-choice candidate, which is beyond me entirely, but I have to sort of let that go, and just assume that, as I think it was Leah who first said, we have to go with society first and then the law will follow. And if we look at what percentage of people believe abortion should be accessible, I would hope that eventually it would follow.
So we have another minute or two, and Willie, would you make some closing comments as someone who's been walking this road a long time and doing this work, and you have quite a wide wingspan in what you've covered. What sustains you in this work, and what would you say to young activists who are coming into this movement and want to have this broader intersectional reproductive justice framework, and kind of build coalitions around principles of justice?
Sure. Well, thank you again for the opportunity to participate. And your first question was what prompted me to participate in the film. And I think for me, the effort to show up as a man, as a person of color, as a person of the Christian faith, all endorsing abortion and access and control for women to control their bodies reproductively, and my showing up with those identities in defiance of what those identities would demand of me as someone, as a Christian. In Christian supremacy, I would be expected to hold an anti-abortion view. As a man, I would be expected to hold a patriarchal view, and demand and insist that women still define themselves primarily by their reproduction. So as an African American person, in response to the allegation of Black genocide, all of those things would require, all of those identities would say that people would expect me to be anti-abortion. And my showing up and participating is explicitly to reject Christian supremacy, patriarchy, and white supremacy. And I try to, just by showing up, provide the counter narrative to that, and to say that there's a place, there's a role, and there's a responsibility for each of us who hold privilege on any of the identities that we hold, to reject that privilege and to actively dismantle it and to undermine it. And so I would say to a young activist that if you really want to change the world, first change your mind and your attitude to be clear about why you are obligated to do this work. And then just, if you can just change the space under your feet, you don't have to, you don't have to have missionary zeal. Just bloom where you're planted and change the place under your feet. Then you will, if we all did that, we'd change the world.
Well, those are wonderful words for concluding. And I think wisdom and inspiration for all. And I want to thank all of you, our panelists, and the program team and attendees for being part of this event and mapping the road ahead for abortion rights and reproductive justice. Clearly our work continues and we've got a lot ahead, but there's some real promising, hopeful signs in this movement that we're part of. So please give again, if you can, to Sister Song and to the Our Bodies, Our Doctors educational team. These links are posted in the chat box. Thank you again for being here and for supporting our work. And if you missed the slideshow at the beginning, you'll get to see that again along with our music. Thank you so much and best of luck to you all.